And now let's turn to the COVID-19 Student Service Corps. How did you come to find it? Well, found it rather, not find it, well, found it. And what's the backstory to it?
So COVID started in New York City. I think the first confirmed case was sometime around the March 1st or 3rd. And
Sounds
for the 5 years I was in Columbia, I worked at one of the student-run free clinics. It was every Tuesday. And so the first Tuesday in March, we had clinic, and it was a little chaotic because we knew that there was a case of COVID and all of these new guidelines were coming out about screening people. And our clinic was in the basement of a church in Harlem. It does not have good infection control processes by any measure because it's not a clinical space, and that's intentional. And so we were kind of scrambling to figure out what we were going to do. And in the next 24 to 48 hours after our clinic, we learned that all of the student-run free clinics at Columbia were going to be shut down for reasons related to patient safety, infection control, and student safety. And at the time, there was a lot of emotion. There's a number of students who volunteered all of these clinics, and at least for the one that I was involved in, there was a lot of anger. You know, we should be able to say when we close, and we're willing to take risks, and we should be able to do this. Confusion, like why is this happening? And also fear. How are we going to take care of our patients, and how are we going to continue to care for these really vulnerable communities who wouldn't seek out other sources for help? And so I saw this as, you know, maybe we can take this energy and do something about it and unite these 5 clinics. And so I and another student, Sarah, and one of our faculty started working together on a COVID task force for these 5 student-run free clinics, thinking that there would be about 10 students or so who would be interested across them. And it turned out that close to 50 students signed up in the first week.
Wow.
And we were really overwhelmed by this response. And so we were trying to figure out ways to sort of change this. But what was happening at the same time was classes that were in person were canceled and changed to virtual. And then eventually students were pulled from clinical rotations. So while all of this was accelerating with the task force, we didn't even have a chance to start it because everything was accelerating around us. And this early foundational work helped to set the stage for when students were finally pulled from clinical rotations the second weekend in March. And there started to be discussions among a broader group of students and faculty at both the School of Public Health and the medical school of how do we involve students in this response. And so it really grew from that. And we started to brainstorm what are the areas that may need student support? How can students actually support safely? We spoke to people who worked in the hospital, who were in communities, and tried to figure out what are the issues that need to be managed now. And really the analogy or the metaphor people kept using was we were building the plane while we were flying it. So we, in 3 days, came up with the structure, the guiding principles, the whole organization,
Wow.
called the COVID-19 Student Service Corps, and released it to the 2 schools in a webinar, and had, I think there were 500 people who signed up in like the first 24 hours. We had 1,300 who were signed up in a week. There's been close to 2,000 people that have signed up to volunteer across the now 3 months that it's existed. And it's been an incredible organization, but it was really about channeling that student anxiety about, I came to a health profession school because I want to help. And in this moment in which help is most needed, I'm being pulled away from the only way I know I can help. And I wanted to, more than anything, be able to give them an opportunity to do something positive in such a difficult time.